let's quickly cut across to China, where the country's National Health Organization is giving a briefing on the coronavirus outbreak.
These are the things developed from the researchers and used by practitioners and doctors and nurses in front lines. We also have great achievements of our initial stage. There are several I would like to mention. For example, in terms of the source of the disease, in a very short manner, we try to separate this virus, and we try to find the sequence of the gene, and then we publicize that into the public, and then making it possible for people to do the follow-up work. And also now we try to use the products in the, for example, immunization field and vaccine development. In terms of the medicine and the drug development, in the initial manner, we select some of the medicines which can turn out to be the possible drugs to cure this disease. And in order to increase the success value and success, we try to develop different technology and science, try to develop the vaccines to attack this new virus. Okay, this lady, please, from CCTV. We have more and more cured patients, and people pay high attention of this cure rate. What is the cure rate, and how long time does it take to cure a patient? Okay, in order to increase the cure rate, I would like to clarify. Currently, in how we calculate the cured rate, we do not have a formula to calculate that, but I want to give you more numbers to answer your question indirectly. And according to statistics, for those the outpatients, the hospitalization days, apart from Hubei province, the national average, the shortest in Hainan, 5 days. The longest is in Guangdong, 12.75 days. Apart from Hubei province, the average time days is 9 plus something days. For Hubei province, it's 12 days. So if you look at the average hospitalization days, it's not very long. They can get out of hospital quickly, which shows our treatment result is good. Hubei province, the average, as I mentioned, is 12 days. It's a bit longer. We try to analyze. In Hubei, it's 20 days. It's a little bit longer. That's because they have more severe patients. And secondly, in Wuhan City, they have a more strict standards for those patients to be released from the hospital. So according to our country's requirement, they have disappearance of the clinical symptoms, and then they need 2 more nucleic tests with 24 hours separation in between. As long as the 2 test results are negative, they are supposed to be released from the hospital and considered as cured. And in Wuhan, even they are okay, they satisfy all the standards for the release of the hospital, they still need to stay there for 10 more days for observation. That's why in Wuhan they have longer hospitalization days. So you may ask why you have so few cured people or cured patients. No, there are reasons for that. It's not because the poor result of the treatment. In order to improve the treatment result and also in order to improve the cured rate, and number one, we try to review the hospitalization cases. We ask the experts to research, review, summarize the experiences, optimize the treatment and diagnostic protocols. And recently, we are going to publish the version number 5, the protocol for diagnostic and treatment for this new disease. As long as those solutions prove to be clinically effective, we will use that. We also use Chinese medicine and Western medicine. So Chinese herb medicine also play a role in the treatment of this new virus. In particular, it can release the symptoms or reduce the opportunity for those mild case develop into the severe case. So I believe the Chinese medicine also play a very important role. We have some clinical data to support that. Secondly, the colleague from Ministry of Science and Technology mentioned that you read a lot of news from media mentioning this option is effective, that is effective. But actually, medical science, remember, it's a science, so we have to obey the nature and the rule of science. We need to have those in vitro results, but the in vitro result is far from the clinical result. And they need to have the animal test and clinical trial. And so in between the medicine developed and a medicine for trial, there is still a long way to go. And now we try to fasten this process. We try to shorten the cycle. But still, we need to respect the science and technology nature, right? And we try to use the good research result into our real practice or the implementation of the medical practice. And sometimes you think some of the medicine, they're effective in the lab. Some of the methods are proved to be effective, but we still want to obey the science nature to change those research results into clinical practice and implementation. Another one is that we try to deploy a lot of doctors and nurses to improve the local level of medication. And all these are very important for us to have more cured patients rate. I believe that you may pay higher attention to the antivirals. Of course, that's important, antivirals. And that is try to find the reason to cause this. That is also effective. But finding if we cannot have other effective, the antivirus drugs there, we have nothing to do to cure people. No, we do have some of the antivirus measures for the treatment. And I also mentioned it's a comprehensive method to treat the patients. And we also have some symptom-focused treatment. For example, we use the breathing machine, and we use the blood screening machine or ECMO, and those facilities. And these are the symptom-focused and symptom-based treatment. As I mentioned, we have the Chinese medicine plus Western medicine or methods-based treatment. They are effective. From January 28th, for the cured patients has exceeds the death cases. But of course, there might be fluctuations with these two numbers, death cases and cured cases. But I believe from current situation, we have already have the achievements for this comprehensive method of treatment. Okay, this lady, please. Thank you. I'm from the Hong Kong cable TV, and in Hong Kong, a man, 39 years old, died. And when for the first time he visited doctors, his situation is okay, but today suddenly he died. So I wonder, in mainland China, do you have similar cases for this new pneumonia? Is that similar to SARS? There is a sudden death happened for a normal patient.
Second question about the checking method. The nucleic acid testing. We see, a person has been checked third times, and they all prove negative until then the fourth time it's positive. And the same thing happened in Guangdong. Only it was not until the third time that was tested positive. And Japan said, we are going to use the smear for testing. So are we going to change our testing method, Mr. Zhao? In the sudden death case in Hong Kong, I'm not well informed. But it's true that some severe patients will, deteriorate, that lead to death, perhaps, due to these underlying medical conditions that lead to the situation. So, which is understandable. So, and the same thing happened during the SARS.